So the news coming out of Bengal in terms of its dealing with the pandemic continues to be very troubling. You're hearing from doctors from within the state who are talking about how ill-prepared the state is in dealing with the situation. And given that we've had a lockdown now for well over 40-45 days, that should have been enough time to put in place an infrastructure, a system that could help ramp up testing. And of course, the state could be more transparent in its numbers as well. So to talk about what's going on, I'm getting in Jaideep Mazumdar.
Thanks, Karan. Right from the very beginning, the state has been in a sort of a denial, and it's been trying the overwhelming focus of the whole entire state administration under Chief Minister Mamata Banerjee has been to assert that Bengal is far ahead of other states in controlling the pandemic. A claim, a tall and false claim that she repeated before even the Prime Minister at the conference of CMs yesterday. So Bengal has been living in denial, and that is the root of all this. Whatever has been happening in the state, the lack of preparedness, etc. Right from the very beginning, in the wake of the Tablighi Jamaat markers in people, all the returnees, and in all other states they tested positive, but somehow in West Bengal there was an immediate blackout of the news, and since then this blackout has persisted, and there has been fudging of numbers, low reporting of cases. Then suddenly we see that certain numbers can't be just concealed. So we see that West Bengal has the highest CFR, which is this case fatality ratio, or you can call the mortality rate, which is nearly 13%. Just to put it in perspective, say the All India figures are 3.3%. Maharashtra and Gujarat, which are very, very badly affected, Maharashtra's CFR is 4%, whereas Gujarat's is less than 5%, and West Bengal it's as high as nearly 13%. So what does this hide? Exactly what the doctors have been saying, and they have repeated yesterday to Mamata, to the Chief Minister, that West Bengal, the testing is very, very low. Initially, one would need permission, the doctors would need permission to send patients for testing or suspected cases for testing. Now, thankfully, that has been done away with it, but it was already too late. Once you give an instruction to the doctors, the mindset develops that no, we will not test, number one. Number two, there has been extremely weak surveillance and tracking of suspects and their contacts, etc. Number three, the high mortality rate also shows that only serious patients are going to the hospitals, whereas had testing been done in adequate numbers, then even patients who are not serious with mild symptoms also would have gone to the hospital, and they would have got proper treatment. But here only ones who are very, very seriously affected, they are only getting to the hospitals. Number four, what it also means is that the lockdown has been very lax. The enforcement of the lockdown has been extremely lax, and I've written about it. Like right from the very beginning, Mamata has her express instructions to the police. The Chief Minister's express instructions has been not to indulge in excesses, which the police have interpreted as okay, we can be lenient, and especially when it comes to dealing with the Muslim community. Okay, what has happened is, like, as a result of the lax enforcement of lockdown, especially in the Muslim inhabited areas, the virus has spread amongst the community, and the state administration's focus has been to suppress the numbers, to prevent the news from leaking out that there. So in order to so-called protect the community, actually the state government has ended up harming the minority community immensely.
There was some change of course though when centre sort of stepped into the state, and of course the Chief Minister resisted. But there's been some change in course in terms of now there are about 338 containment zones that have been identified. And it seems like there's a little bit of more sort of work going on in terms of dealing with the pandemic. However, as you point out, the numbers show a very grim situation. But the Chief Minister seems to be saying a totally different thing, especially in light of what she said in her discussion with other Chief Ministers and the Prime Minister as well, isn't it?
Yes. See, if the water level rises above your nose, then you have to stay afloat. At least try to stay afloat. This is exactly what happened. The interministerial central teams, two of them which had come to West Bengal, they knew that they couldn't hide anymore. When they asked for the records, like for instance, they were claiming that we have tested lakhs of people all over the state within a short period of time. When the IMCTs, they asked for the records. Where are the records? Show us the records. They couldn't provide the records. Mamata, the Chief Minister herself, claimed a few days ago that a few lakh households have been tested and have been surveyed in West Bengal, whereas the number of households that she quoted, the actual number of households according to the census figures, is less than half of that. Okay, so here every time there is a fudging of numbers, trying to show that we are ahead of other states. This weird sort of preoccupation with trying to show that Bengal is ahead of other states, which was reflected in yesterday's meeting with the Prime Minister as well. She was quoted as saying that though we are doing much better than most other states, but the center is targeting us. But however, we want more money than all the other states. Okay, so if you are doing much better than all the other states, then why do you need more money than the other states? It's as simple as that.
And to add to all this, there are, of course, communal clashes also reported in the state recently, isn't it?
It's very unfortunate what has happened, and again because of this wholly misplaced policy, which actually harms our minority community in the long run. This is exactly what happened. Like they wanted many of them who had come back from the Ajmer Sharif. They were brought back by these trains. They tested positive in pockets of Malda and Hooghly district. And the state government wanted to take them to quarantine because they were staying in very densely populated areas. They resisted, and some others belonging to the Hindu community, they didn't want them to be roaming around the streets. So somehow that anger got vented on the Hindus, and clashes broke out, and the police have allegedly played a partisan role once again as far as this is concerned.
Okay, great. Thank you so much, Jerry, for joining us on Direct Time.
Thank you.